I am happy to now introduce Sean Egan, who is the Deputy Director of Labor for the state of Michigan. Sean brings a total wealth of experience across all areas of the economy with his background in the Navy, as an electrician and a lawyer. And his focus at labor economic opportunity is primarily on overseeing MIOSHA, Workers' Disability, and the Compensation Agency, the Bureau of Employment Relations, and the Wage and Hour Division. He also supports LEO's efforts across the spectrum as his experience spans many of the goals. And he's also been our contact there for working on COVID efforts for the state of Michigan. So I'm going to pass it over to Sean. Sean, do you want to share your screen, or would you like Ryan to pull up your presentation for you?
I will share my screen in just a moment, Anne Marie. I did make a couple of updates on the slides that I did send over, which I will share with you so everybody can have them. Just want to thank Paul and Anne Marie for having me on today. It's great to follow up Dr. Lee. I think it'll really help you understand what these rules are designed to do. So we're going to focus a little bit today on the rules. I will touch on DHHS a little bit, but as you know, that is a separate department. So certainly there are considerations there that we would not necessarily try to navigate. Really our goal in the Michigan Department of Labor is to get open and stay open, and containing COVID is the key to doing that. So we're really working hard to put in reasonable rules, make sure that we do a lot of education and outreach with which Paul and NSF are helping with, that I'll share a little bit about. I'm going to talk really fast. We have some slides with way too many words on them that I will talk through as we're trying to all keep up with the requirements that we're trying to navigate in our workplaces to keep our employees safe, as well as our customers and our communities. As Ruby shared, I won't spend too much time on this, but just reiterating, from the outset of this crisis, there have been three relatively static concepts that we've been working through, and that is the need for social distance, face coverings, and good hygiene. As Ruby mentioned, there's a lot of spread from asymptomatic carriers, believed to be around 40%. So these are folks that are going to get through your daily health screenings. They're going to be shedding the virus. They're going to feel fine, and they're going to be out going about their business, which is why it's so critical that we just maintain those distance, mask, hygiene, because that virus is going to be out there. And when we're both wearing the face coverings, we believe that we can cut transmission by as much as 70%. And it's just huge that we continue to do that. Now in Michigan, we're tracking workplace outbreaks. You can find this information every week at michigan.gov coronavirus. It's under the cumulative data tab. And just for reference here, I take out all those places that we might have a lot of non-employees, so we can really see where we believe employees are having outbreaks in workplaces. So I don't include schools and colleges, childcare, nursing homes, a lot of big numbers in those places. Certainly employees are getting sick, but really focusing in on just to show the scale of what's happening out there. Right now, DHHS is tracking 267 ongoing outbreaks. About 93 of those are associated with manufacturing or construction, 40 are in office environments. 105 new outbreaks reported the week prior to the 23rd. 15 of those are in office settings, 43 manufacturing or construction. The retail number was actually lower that week than it was the week before. So we're just continuing to see these outbreaks across Michigan. And just for reference, about 10 were reported in that week for social gatherings. Now, that doesn't mean that workplaces per se are a challenge, but as Ruby mentioned, congregation is bad, separation is good. So anywhere that we're bringing people from different households together, we're going to see these types of challenges. And seeing these numbers also tells me that employers are doing what they're supposed to do. They're notifying local public health. They're making sure that that contact tracing is taking place, and that's good. Now, an outbreak is, by DHHS standards, is 2 or more cases linked to a place and time. So this is not just a person coming into those settings that was sick, but 2 people that can be connected in that setting because of that contact likely have gotten the virus in that location. And as you know, everybody knows, the news in Michigan across the country is challenging for COVID. Our case numbers are extremely high. Our positivity rate was at 13.7% when I checked today. That means essentially it's everywhere. And what you need to be thinking about is that if it hasn't already, if you have people coming into work, COVID is coming into your workplace. And you need to be prepared on how you're going to manage that, as well as try to mitigate the risk of transmission. Now, over the summer, I know that a lot of you got quite familiar with the emergency orders that were issued by the governor after the Michigan Supreme Court ruling. We moved to different concepts. So on October 14th, MIOSHA issued emergency rules that does cover museums, retail, you name it. Almost every employer in Michigan is covered by the MIOSHA statute. There are some limitations, but I'm sure that nobody on the call meets one of those limitations. So you are covered. One of the things we tried to do here was make sure we had consistency between what you were doing to what's expected of you now, as well as taking out a few things that might not have made sense or we didn't want to carry for several months. When we issue emergency rules, we expect these to be static for about the next 6 months. So the way I suggest to everybody that they really start to get in the game here and understand this is get those emergency rules, understand what it is you need to do, have those preparedness and response plans, and then layer in the DHHS epidemic orders that might come out. DHHS, we expect to be a little more variable as COVID changes, as our numbers go up and down. You're dealing with that now with those capacity limits at 30%. So those things are going to be things that you will layer in, but we expect these workplace rules to remain relatively static. So you should have a good opportunity to really hone in on those and make sure that they fit. We've also launched a few state emphasis programs. These are programs that are proactive enforcement strategies from MIOSHA. We're going to highlight this time offices, manufacturing, and construction, and that could include some of your operations. We did hospitals, retail, bars, and restaurants over the summer. What these are designed to do is recognizing those outbreaks and different types of complaints that we've been continuing to receive in all of these sectors. Our inspectors are going to randomly select workplaces in those categories and just stop in. They'll announce themselves to management and they'll do an inspection on the spot. And I can assure you that these are not intended to be gotchas. They're going to work with you to identify things that you could fix, maybe change. If you're not doing some things, you may see citations come out of this. Some of the must-haves you absolutely have to have when they show up, they're going to ask you for your preparedness and response plan. Now, I know, talking with Anne Marie and Paul, that you are working with NSF. Many of you are working collaboratively from the outset of this virus to make sure that you had those things in place, and I applaud you for those efforts. It's critical that we all take this to the extreme on things that we might be able to do. But so I know that the vast majority of you are going to have those plans. If you don't, MIOSHA has created a template on our COVID workplace safety website for low and medium risk work environments, and that's the vast majority of employers in Michigan. You need to designate that COVID coordinator. It does not need to be a manager. This is just somebody on the ground that's going to be your boots on the ground to make sure that these COVID protocols are being put into practice. Now, you can have more than one. If you have different parts of your building, you have an office, you have the floor, you have whatever it is you're doing, you can have more than one COVID coordinator. You have to be conducting those daily health screenings, which must include a questionnaire. And you can use the My Symptoms app that was created by DHHS and U of M to do that for you. It's an electronic tool. You sign up as an employer, it's free. You'll get an employer code that you give to your employees, then they can use their smartphone, tablet, desktop, you name it, to answer those questions. It'll let them know if they've flagged for symptoms. Employers have a real-time dashboard to keep checking, and it'll take care of the record-keeping requirements required by the rules in MIOSHA. Need to be conducting that training of your employees, including how COVID spreads, mitigation strategies, how to comply with your plans and policies. And I'm going to touch on the remote work policy because we've gotten a lot of questions on that over the last few weeks, of course. Now, within our MIOSHA rules, we do have some face covering requirements, and this includes employers providing those non-medical grade face coverings, requiring employees to wear them when they cannot maintain 6 feet of separation, considering face shields if they work in close quarters within 3 feet of separation. That's in addition to the face covering itself to help further mitigate the chance of spread, and then always requiring employees to wear those when they're in shared spaces. And that's going to be in-person meeting, restrooms, hallways, you name it. Now, I know that museums were lumped in with retail, and DHHS's order does have additional face covering requirements where employees are more than likely going to be wearing those all the time, as well as customers. And within our rules, we do have industry-specific requirements, which does include museums, libraries, and retail. One of the bullet points I want to point out here is that within our rules, which I mentioned we expect to be static for the next several months, you must require patrons to wear those face coverings unless they cannot medically tolerate it. Now, we do not expect you to have an employee standing at the door pushing people out of the museum, but we do expect you to make a good faith effort. You're going to have those signs that say don't come in, face cover required, etc. The goal here, as Ruby went over in great detail in her presentation, is to really break that chain of transmission, cut down the probability of spread, make sure your employees are protected to the maximum that they can be when we're trying to battle this virus, and just making sure you're doing those things. More than likely you have these things in place, but just wanted to highlight that for you. I know that in many of your operations, you're going to have certain areas where the general public might be coming in. You're going to have areas where the general public is not coming in, which might be more of an office type environment. We do include in the rule that employers must create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So we've gotten a lot of questions on that, as you can imagine, but the goal here is congregation is bad, separation is good. So if you have activities in your office type settings that don't necessarily require a physical presence, please get those people out of the workplace and include that in your policy. This does need to be a written policy. It can be integrated into your preparedness and response plan, does not have to be a standalone document. And you have to include the classifications and positions that must report for in-person work and why, and the reasons that they cannot be performed remotely. Well, a few of the questions I've got on this is about collaboration. That is not going to be something that can't be done remotely. What we're looking at there is we understand that some people will need to be present. You have mail coming in, you have certain database components that might not allow a VPN connection or some other tool to be used. We understand that, but you really need to analyze your workforce and have as many people out of there as you can do. And MIOSHA is going to look at that policy, and they're probably not going to dig too deep into the details if it's reasoned and thoughtful, but if it's just because I feel like they need to be here, that's not going to work. You're going to need to go deeper than that. I do want to spend a minute on quarantine and isolation. This is a critical tool, and we do get a lot of questions on what this means. The rule does require that you physically isolate employees with known or suspected COVID. Suspected includes those close contacts within 6 feet for 15 minutes or more. That's a cumulative 15 minutes over a 24-hour period. And the goal here is to mitigate the potential spread of COVID in our workplaces. So that includes keeping those folks out of the workplace, sending them out of the workplace if they get sick during the day. And then this C here is intended for those remote workers that I mentioned for the remote work policy. It is allowable for you to work with an employee that may have COVID or may have been exposed to COVID. If they can work remotely and they feel confident that they can continue to meet their duties, that's fine, just as long as they're not in that congregating setting of the workplace itself. And then quarantine occurs when you have a close contact. You have not been confirmed with COVID, you don't have any symptoms, but you had that 6 feet for 15 minutes or more. That's a 14-day period from the last close contact. And it's written that way, recognizing that some people are caring for people in their home that have COVID, or maybe even outside their home that have COVID, known COVID, and they're going to have multiple close contacts over and over. So that 14 days can actually keep continuing to move and push out that possible return. And then we isolate people when they either have symptoms, they're confirmed with or without symptoms. And that's going to be a 10-day period from when those symptoms first appeared or they got that confirmation, and then 24 hours with no fever, without medication, and other symptoms are improving. So it's really critical that you understand these pieces and that you apply them as quickly and practically as possible so that, as Ruby mentioned, we can break that chain of transmission. Now, we have all of these materials available and more at our website at michigan.gov, COVID Workplace Safety. They've been up there since May. We have guidelines for every industry that's been named. For museums, I would look at the retail. Definitely check out for all industries. We have an updating FAQ on the emergency rules themselves based on questions we've received coming in. It's a great resource for you to get some of those questions answered. We have a wonderful hotline staffed by the MIOSHA folks at 855-SAFE-C19. They launched this in May. We get hundreds of calls. This is for employers and employees with any questions you may have about the rules or other things in your workplace. And if you need it, they will help get you over to the consultation team, which is a wonderful vehicle at MIOSHA. We've launched a few consultation programs. The Ambassador Program now, I haven't updated the slide yet, but now is in partnership with NSF to help us really ramp up the program. These are one-on-one pop-in consultations. This is not enforcement focused, where consultants will just stop in at various sort of open to the public type establishments, would be restaurants, bars, small retail, other locations where what we call heightened community transmission risk, where you have an open workplace setting that the general public may be coming into. The goal here is that many of these locations don't regularly interact with MIOSHA. So they might have some understanding of some workplace rules that they need to do, but they don't follow it closely like other large manufacturing or construction, where they more than likely have safety professionals on staff and those types of things. These folks can also request a consultation. It's a longer version. It's a wonderful tool. And all of the program material and toolkit are available on that same website. And then for those folks that may not fit into those categories, you can always request a consultation from MIOSHA's consultation team, and they can do that on site, over the phone, or otherwise. We're really pushing the over the phone the best that we can, only because there's a lot of demand. And we've launched the NSF partnership program just a few weeks ago, and that demand is quite high as well. So we're going to be working through that to really ensure that we're continuing to provide that educate before you regulate mantra that MIOSHA pushes out there, to provide the tools that employers need to keep it going and moving forward. We have great links on our website to the Pure Michigan Business Connect platform as a resource you can use to find PPE, non-medical grade face coverings, plastic barriers. The My Symptoms app that I mentioned, recently launched My COVID Alert, is a free app that will use cell technology to identify if you sign up when you've been within 6 feet of somebody that has COVID. So that's a great resource there too. And we're just really trying to continue and push our message. And our goal is to ensure that employers have what they need, people understand what they need to do. And as I mentioned, just really trying to get that distance, face coverings, and hygiene nailed down.
Do we have any questions for Sean Egan? Okay, well, it's looking pretty quiet out there.
I had a note in my head, Anne Marie, if I could be real quick. If you go, our Michigan Department of Labor YouTube page has all of the webinars that we've done. Speaking of that indoor air, we did a 4-part series with ASHRAE to talk about how the virus can spread, system things that might impact that. So definitely check that out if you're interested. Like Dr. Lee said, we see that as a potential mitigation strategy. General ventilation itself is not the panacea, but it can impact how things are happening in your workplace. So definitely, if you're interested, check that out.
Great. Thank you so much, Sean. What I'll say is, if anyone has any follow-up questions that you think of throughout the rest of the symposium, we can get those to Sean and get a response back to you, but we'll share the slides and we'll share the video of this moving forward.
Anne Marie, I think we did have a hand up. I think Mike Bergman might have a question.
Thanks, Paul. It's Mike Bergman from College of Creative Studies. I had a question, Sean. When do you think, in your best guess for the vaccine, you think the early spring for the vaccine to be available to the public? And then are you going to talk about point of pods, for example, point of distribution?
So most of the vaccine stuff, Mike, is going to fall with DHHS and probably won't be in our wheelhouse. I have gotten the question about how the rules might change. My advice to everybody is that what we're seeing, what we're hearing is that we have that glimmer of hope, but for the most of us in our workplaces, we're going to have to keep our head down and keep moving forward with these mitigation strategies for what I see as several months. And what I mean by that is, I don't know how that'll unroll. Hopefully it'll be faster than what we're hearing, but I think we're looking at, June, July, August, later in the year by the time we get enough of us regular working folk, the medical people will be first, right? For us to really start to think about like the next steps beyond COVID, for sure.
Okay, thanks, Sean. I appreciate it.
Yeah.
Any final questions? Okay, well, great. So well, if anyone has any further questions, oh, Ashley, do you have a question?
Yeah, hi, Sean. Thank you so much. This was really helpful. I was wondering if you could speak briefly about the flu, getting a flu vaccine, and whether or not the state is going to actually try to enforce that, or is it just an encouragement? I'm with Wayne State, and we've already gone through and basically told folks that they need to either get the vaccine or provide a waiver as to why they're not getting it. But I was just wondering if the state was actually going to come out with anything on that, or if that was just a institution or employer by employer item.
It'll largely be an employer by employer component. There's a few reasons for that. One is that, the state likely can't mandate you to get the flu shot, right? So certain employers will have to look at their operation, what that means. I can tell you, and I appreciate you doing that, Ashley. We know that the flu symptoms look a lot like COVID, so we're going to have that issue. We've been told, and we know that you don't want both for sure at the same time. There is some indication that just boosting your immune system with the flu vaccine can help you a little bit with some of the other illnesses that we have in the fall. But I think that that's a good way to look at it. And then certainly, as you know, you want to look at EEOC and some other ADA things on where you can and can't require those pieces.
Okay, well, thank you very much, Sean, for participating in our symposium. It was great to have you, and good luck with all of your efforts moving forward with dealing with this pandemic in Michigan.